Let's go. Muscular system. So yesterday I described the overall arrangement, right, of muscles. I've already talked about this before, but keep in mind, right? So here's the bone, here's the tendon, right? Here's the muscle, right? So skeletal muscles are attached to bone through tendons. Tendons are made up of dense, regular connective tissue, which is mostly made up of tough collagen fibers. So these are tough collagen fibers, very hard to tear them, very hard to rip them, right? Although it does happen, okay, you can tear a tendon by obviously placing too much tension, compression, doing too many repetitions. If you lift weights and you do a lot of repetitions on your whatever it is that you're doing, you can place a lot of stress on the tendon, and you can actually tear that tendon. Okay, so now tendons, they extend out into the muscle. Okay, so they form epimysium, they form perimysium, and endomysium. These are sheets of connective tissue, the same type, collagen fibers, which wrap around the muscle and the fascicles. Keep in mind, these are called fascicles, right? And they protect, right? They protect those fascicles and the larger muscle, for that matter, by providing that protective sheath, right, layer around them. So here's a fascicle, right? If you zoom into the fascicle, you can see a lot of muscle fibers. Okay, muscle fibers right there. If you zoom into the muscle fibers, what are you going to see? You're going to see a lot of myofibrils, which contain the sarcomeres. Okay, so each muscle fiber contains thousands, hundreds of thousands of sarcomeres lining the length, right, of the muscle itself. All right, so all of which contract in the manner that we learned about yesterday. Okay, so just real quick, three events, right? First is what happens at the neuromuscular junction. Second, excitation, contraction, coupling. Third, cross bridge. Okay, there's a helicopter, and I don't know if you guys hear it. Okay, so now in terms of skeletal muscle, right? There's terms associated with them that you have to know, okay, that you need to know of and be well versed on, okay? Yeah, so you'll sound smarter, right, when you talk to your friends, right? So you sound a little bit nerdier and a little bit more interesting, but also because when you go on to the medical field, when you go into your career, the doctors you work with, or if you're the doctor, then you're going to use these terms for sure, and you need to know what they are, right? So we have different shapes of muscles. We have circular muscles, obviously in the form of a circle, right? I'll go into examples as I talk about muscles gradually. And then we have multi-pennate muscles like the deltoid, which is made up of several heads, okay, an anterior, middle, and posterior head. Also, the quadriceps, right, the muscles of the anterior leg, those that muscle has 4 legs. Okay, so it's divided up into 4 large legs. So again, multi-pennate. There's also convergent / triangular types of muscles. This muscle is a large muscle, like the pec major, right? Pectoralis major. This is a very big, bulky muscle, right? It's convergent because all of its fibers, right, originate right along the sternum and the clavicle, right? We can see them right there. And then they all converge. They all converge onto one end. All right, so that one end becomes an insertion point on the humerus. Okay, so again, it originates on the clavicle and sternum, and then converging all of its fibers onto one insertion point, which is proximal humerus. All right, so that right there kind of gives you a hint of what the action of the pec major is going to be, right? Its contraction is going to go ahead and pull on the entire arm. So in case you didn't know, right, your pectoralis major is involved in moving the arm, all right? Now, if you lift weights and you do a nice, thorough session on weightlifting, then you know what the pec does, because I'm not very versed in exercises, right? But there's some different types of exercises that you can actually target the pectoralis major. Correct me if I'm wrong. Something press. I'm not sure with the names of the exercises, right? But you know what I mean. So there's also a fusiform, right? Convergence slash fusiform. What this means is that fusiform muscles, they're thick in the middle, right? So they tend to be thick in the middle, and then they taper off on the ends. All right, again, thick in the middle, and then they taper off on the ends. Okay, so bulky in the middle and then narrow on the ends. That's what fusiform means. So biceps brachii, that would be a fusiform type of muscle. We have unipennate muscles, meaning they only have one head, right? And that one head would act as the insertion point, right? And like, for example, the flexor pollicis longus, right? So this muscle right here goes ahead and attaches. It originates from the proximal ulna / radius, right? And then it inserts onto the digits, right? So what does it do? Its contraction pulls in that direction, and then in that manner, right, in that process, moving the digits, moving the fingers. Okay, so this flexor pollicis longus is the reason why you can actually move your thumb. Okay, so he said, just to make it kind of like an extension to this, all ape species, right? Most ape species have a rather developed flexor pollicis. We still have it, but it's not as developed as that of a gorilla, for example. Okay, because obviously they climb trees, right? And they walk on mostly on fours, so they have to have a very well developed flexor pollicis. Now you can develop it, right? So if you just do a lot of exercise for this muscle, or maybe a soldier who's always carrying a gun, right? Those guns are not light at all. Those are heavy. Okay, so carrying that gun and being able to point it and shoot it, right? That takes a lot of forearm strength. So a lot of soldiers tend to have very big, large, bulky forearms, right? Again, because of the fact that they have to carry all that weight when they're training. They don't run. When they're running, they don't run light. Right? They have to carry a big, a lot of weight on them. So their muscles tend to be very bulky, and so on. Now wrestlers, right, tend to have large forearm muscles here, because again of the extensive use of the hand. So the more you use your hands, the thicker these bones. These muscles are going to be, and those bones for that matter, because the muscles are pulling on the bones, putting strain on them, which over time, right, allows them to gain calcium, which makes them obviously thicker. We also have parallel muscles like the sartorius here. So parallel muscles, they resemble fusiform muscles, but the thing is, their thickness is actually it stays throughout the entire muscle, right? So it's the same thickness all throughout. You don't see bulky in the middle and then tapering off on the ends. No, parallel muscles have parallel fibers that run longitudinally, right? And the thickness of the muscle stays the same throughout throughout the length of the muscle. So the sartorius here attaches on the iliac, originates on the iliac crest, and then it attaches, inserts onto the tibia. Okay, so the lateral end of the tibia over here. So what that does is going to go ahead and allow you to rotate the leg. All right, so if you rotate it outwards towards that direction, right? So again, rotating it, not abducting it. That's different, right? So rotating it. In order to bring it forward, to the same position, you use your sartorius muscle to allow you to bring that leg rotation back to normal, back to anatomical position. Okay, so and last but not least is bipennate muscles, meaning that these have two heads. Okay, so bipennate, two heads, multipennate, more than two heads. The rectus femoris, right, which is the main muscle of your anterior upper part of the part of your leg, right, has two heads. Okay, it's a large muscle, one of the largest muscles in the body. Not the largest, but one of the largest. By the way, the sartorius is the longest muscle that you have in your body. Okay, so what the rectus femoris is going to do, right? It originates on the ischium. If you recall the ischium from the pelvic bone, right? So it originates on the ischium of the pelvic bone, and then it inserts onto the patella exclusively. The patella, which is the knee bone, right? There is a connection, the tendon connection between the muscle and the patella, and the tendon connection between the muscle and the ischium of the pelvic bone. So its contraction is going to go ahead and pull in that direction, right? So that you can bring your lower part of the leg back to anatomical position. Okay. So in order to flex the leg, you're gonna have to use your hamstrings. Okay. So the rectus femoris works is an antagonist to the hamstring muscles, which are located on the back, right beneath your buttocks area. That's where you have your three sets of hamstring muscles. And the rectus femoris, as long as the vastus lateralis, vastus medialis, which are part of the quads, right? Those are antagonists to the hamstring muscles. So when you flex your knee, right? You flex it obviously towards the back, then your hamstrings is activated. In order to bring it back, you need to use your rectus femoris as well as the other quads, so that you can bring that leg back. Okay, so here are more important terms. And we're gonna go ahead and divide these, divide these up by in different dimensions here. So we have muscle size, muscle location, muscle action, body region, fiber origination, muscle heads, shape, right? So those are different dimensions. Let me go over these real quick. I'm not going to spend too much time. But brevis, longest, vastus, right? Brevis short, longest long, vastus would be wide. You know these, right? Anterior, external, infra below, right? Supra would be above. Intercostal is between the ribs, internal, inside, obviously. Posterior back, profundus deep. Superficial, you know what that is. It's close to the skin. Supra is the opposite of infra. Action, abductor, meaning pulling away, as mentioned yesterday, away from the midline. Adductor, towards the midline. Depressor, you're going to pull down. Erector, hold straight. Extensor, increase angle. Flexor, decrease the angle, right? So levator is raising a body part. Pronator, turning, for example, the palm posteriorly. Keep in mind, anatomical position, right, has palms facing forward. If you pronate those palms, right, you can try it right now if you want. Pronate the palms towards the back. Again, that's called pronation. Your forearm has pronator muscles that allow you to do that function. Okay, and then supinator would be palms anteriorly. So normally anatomical position, right? Normal anatomical position has your palms supinated. Okay, so supination, pronation. Those are very important terms. In the body region, we have abdominis, obviously, oh man, obviously the abdomen. brachii, the brazos, the arm, if you know Spanish, it helps a little bit, right? Capitis, cabeza, right, the head. Region carpi would be the carpals, which is wrist, obviously. Cervices is cervical, which is neck. Digits, digitorum, which is the fingers. Femoris is the femur. Gluteal, obviously the buttocks. Keep in mind hallux, right, which is the toe. Oculi is the eyes, obviously. Oris, right? So we learned all these terms back in what's it called in body regions, right? A few weeks ago. And we have orientation. Oblique is at an angle or to the side, like your oblique muscles of the abdomen, okay, which allow you to rotate your entire trunk, right? Oof. Orbicular means in a circle. Rectus is straight. Transversus is across, like your transversus abdominis, okay, that you have in your lower abdomen. Muscle heads, we have biceps, 2 heads, quadriceps, 4 heads, triceps, 3 heads. We'll go over, all the muscles so you'll know which ones I'm referring to. And then shape, like the triangular deltoid, okay, on the lateral aspect of your arm. Maximus is obviously large, minimus is smallest, minus is small but not as small as minimus, right? Quadratus, rectangle. Rhomboid is a rhombus, like your trapezius muscle, right? Is has that kind of rhomboid shape, although there is an entire shape for trapezius. Okay, but regardless, you'll see in a few minutes how that shape allows for different muscle coordination and different body region movement because of the extensiveness of the muscle. And we have serratus or serrated, or which is jagged essentially. Okay, so serratus, the serratus muscles occur in your superior lateral aspect of your ribs, if you will. So right below your axillary region, right, your armpit, right below, you have your serratus muscles. If if you're skinny enough, or maybe if you are if you're into working out, then you probably can see those serratus muscles. Again, lateral but superior on your rib cage, right under the armpits. Now, functional groups of muscles. Okay, so these are the one I explained. These already fixators, as the name implies, stabilizes, right, a joint. Right, so fixator muscle, like the supraspinatus, for example, it stabilizes a joint as you're moving it. Okay, so now this dude right here is trying to drink some water, right? In drinking the water, the synergist is going to be the biceps brachii. Right? The agonist is going to be the brachioradialis, or brachialis and brachioradialis, which you don't see here. And then bringing that arm back is the antagonist, which is the triceps brachii, 3 heads. Now, again, without the supraspinatus here, then you could do that, and I'm not saying that you can't, but it's just going to be a little bit harder to control that movement. Let me give you an example real quick. President Trump, right, a few days ago, he's giving a speech, and he drank some water, and he was having trouble. He was having trouble holding that cup of water. I don't know if you noticed, right? If you haven't, look at the video. He's having trouble. He had to use the other hand to hold that cup of water to his mouth. Okay, so I'm thinking, right? He had problem with his rotator cuff right here in the back, and with his fixator muscle. Now, muscle origins and insertions. I've talked about this. The origin of muscles. Keep the muscle held in place. Okay, so they keep it held in place, and it acts as the anchor point for that muscle to go in and contract, right? So here's the anchor point, which would be the superior proximal end of the humerus, and also the coracoid process of the scapula, right? So that's where the biceps brachii muscle originates. It inserts onto the ulna/radius, and then its contraction, right, pulls on the forearm, so you can do this action. Okay, this is called flexion right here. All right, so now bringing it back is going to require you to relax the biceps brachii and utilize your triceps, right, so that you can bring that arm back. And not only bring it back, but keep it stabilized as you bring it back. Because if you don't use your triceps, which is pretty impossible to do, right? But people who don't have use of their triceps, right? they just kind of, because of nerve issue or whatever, just kind of let that arm fall right onto their sides without any stabilization. All right, so I'm going to talk about all of these superficial muscles, which you can actually touch on your body and probably see most of these things, especially if you're an athlete, if you work out a lot. Okay, I know I keep going back to that. I'm sorry, guys, but it's it's a very useful instructional tool when teaching anatomy. Okay, that's why anatomical models tend to be people that are very fit, because they show muscles a lot. All right, so here it is. Let me go over these. Please take a note, because these are very important for you to know. So starting off with the head. Okay, in the head. And by the way, I'm gonna ask you to to do some activities there, some exercises there, so that you can actually feel these muscles in case you haven't felt them before, right? So on the head, we have the temporal muscle. We have masseter, epicranius. We have orbicularis oculi, zygomaticus, and orbicularis oris, and these are superficial muscles. Okay, by no means all of the muscles. We have a lot more muscles, and we'll go over them as we move along. Okay, first and foremost, temporalis. Go ahead and bring your arm, your hand, whichever hand, to right above your ear. Okay, and then go ahead and bite down. Feel the contraction of the temporalis muscle. So what do you think the action is, right? The action obviously is in moving the mandible. Okay, so bring that mandible up so you can chew, right? That's part of the action of the temporalis muscle. It originates on the lateral end of the skull over here, and then it inserts onto the a lower end of the skull over here by the zygomatic bone. And from there, it makes a connection to the masseter muscle. Oh my God. Makes a connection to the masseter muscle right here through aponeurosis, which again allows them to work synergistically in order to chew, to masticate. Okay, so masseter muscle. I believe we've done this already, but go ahead and bring your hand to the side of your cheek, but very close to your ear. Okay, so go ahead and bite down. That big muscle right there, that's the masseter muscle. Okay, so we have even though it's a strong masseter muscle, rather large, it's not as large as other species. Okay, if you're a dog owner, especially if you have one of those very muscular species of dog like a pit bull, right? Those tend to have a huge, gigantic masseter muscle. Okay, so you don't want to be bitten by one of those dogs, because those masseter muscles are going to destroy, right? They're going to destroy your tissue. Okay, so pretty big. The bigger the cheeks are in the person or in the animal, the larger the masseter muscle they have. So the more strength they can generate rather in the oral region in terms of mastication. Okay. Moving to the epicranius frontal belly, but also the epicranius occipital belly. We have two. One in the forehead, the other one in the back, in the occipital region. So you can see as you move your eyebrows up. So go ahead and move your eyebrows up real quick. You can evidently feel your epicranius frontal, right? Otherwise known as the frontalis muscle. You can feel it contracting, obviously. But go ahead and bring your hand to your occipital region, and then do the same eyebrow function. So go ahead and move your eyebrows up. Hopefully you can feel the occipitalis working, okay? So occipitalis has two heads, right? I mean, two bellies. One frontal, one occipital, both connected by this sheath of connective tissue here on top. That's called an aponeurosis. Aponeurosis right there. Okay, so what do? They're involved in facial expressions and raising your eyebrows, right? So that you can allow more light to enter your retina. Okay, so now orbicularis oculi. Okay, it's a circular muscle that lines in obviously circular fashion your eyes. Okay, the external region of your eyes. So if you contract the muscle, you're gonna go ahead and close up your eyelids. Okay, you close them up. That's obviously by contracting. Okay. If you relax it, you go ahead and open up your eyelids so that you can allow light to move in. Okay, so now zygomaticus is next. It's located on the cheek, superior cheek region. It's mostly facial expressions. Okay, so it's mostly like smiling, for example. That's what zygomaticus is going to do. It's going to originate on the upper end of the zygomaticus bone and then insert onto the orbicularis oris right there to go ahead and pull it in a diagonal manner. Okay, so it pulls it in that direction, and that obviously, right, has different actions on on your mouth there. Okay, so for the most part, smiling, right? But you can say, we say facial expressions. It is involved in many facial expressions. Orbicularis oris would be your mouth. Okay, so the muscle that lies underneath the skin of your lips. Okay, so that would be the orbicularis oris. All right, so it traverses the entire mustache region, right? So right under the nose, and then it goes right below, right by the mentalis muscle, which is right there, right? And obviously in a circular region aspect. So the orbicularis oris is under the influence of all of the superficial and deep muscles of the face, okay, all of them. Their contraction goes ahead and pulls on the orbicularis oris so that you can achieve all of your facial expressions, okay? There's this big muscle or large curtain of muscle, if you will, which is called a platysma, right? It covers the anterior aspect of your neck. Its contraction goes ahead and pulls on the orbicularis oris, as well as other muscles of the mental region, so that you can go ahead and pull your lower lip down. Okay, so it kind of depresses your lower lip, if you will. You can try it right now, right? So go ahead and pull your lower lip down, but only the lip. It's kind of hard. So again, that right there is evidently your orbicularis oris being influenced by other muscles. Alrighty. So again, these are superficial. These are ones you should be able to feel as you move them, okay, as you contract them. So let's go down to the shoulder region, right? The shoulder, one of the major muscles of the shoulder is called the deltoid, and here's the deltoid right here. It's a multi-pennate muscle with three heads, one anterior, medial, and one posterior head. Okay, so this is a rather large muscle that originates on the clavicle slash scapula. Okay, so both of those bones. It goes ahead and inserts onto the proximal end of the humerus laterally, right on the side of it, and it makes an insertion point on the deltoid tuberosity of the humerus bone. So its contraction pulls the fibers in that direction, right, towards the midline, which has the opposite effect on the arm, right? So even though the fibers pull in that direction, that pulling brings the arm up, right, for abduction. Okay, so moving the arm away from the midline is called abduction. So that's what the deltoid does. Let's see. Let's talk about the neck, because I think I skipped the neck here. So we have a few superficial muscles of the neck. We have the sternohyoid, which is located in this region here. The sternohyoid connects the hyoid bone. We call the hyoid bone from a few lectures ago. It's the only bone in the body that is not joined to any other bone. Okay. It's actually held in place right above the cartilage of the trachea, of the pharynx, and it's held in place by all of the connective tissue, right, in that region right there. So it turns out that the sternohyoid makes an indirect connection to the sternum, and it plays a role in depressing, right, the hyoid. So it depresses the hyoid bone downwards, obviously, which is utilized in during speaking, talking, laughing, right? So anything that we do to move the mouth indirectly, right, and the tongue for that matter, is going to go ahead and be influenced by the sternohyoid in to some extent. Then we have the sternocleidomastoid. We have two of those, right? So one on each side. So go ahead and do this action so you can feel it. Go ahead and tilt your head forward and then to one of the sides, right? To one of the sides as far out as you can, and then touch the side of your muscle so you can feel that large sternocleidomastoid. Okay, so again, it's on both sides, and the action is pretty evident as soon as you start moving your head, right, and feeling it. It helps in rotating, right, the head. So head movement. Now let's break down the name real quick. Sterno is sternum, cleido, clavicle, and mastoid. Mastoid refers to a marking of the temporal bone. It's called the mastoid process of the temporal bone. So it originates on the temporal bone, mastoid process of it, and then it inserts on the sternum and clavicle. Again, to allow you to move the head in all directions, essentially, especially left and right. Then we have a platysma, superficial muscle of the neck. You can actually feel that. Okay, so let me see. It's kind of hard to describe the function, but if you, I don't know if this is going to make sense, but if you can contract your neck superficially, I know that doesn't make sense, right? But you can notice that platysma muscle in older people that have wrinkles in the neck region. Okay, so those wrinkles make the platysma very obvious. All right, so it's a very superficial muscle. It originates on the clavicles, both clavicles, and then the manubrium of the sternum, and then it inserts onto all of the mental region muscles right here to pull on them, right? So they go ahead and pull the platysma's contraction pulls down on the mental region muscles, so that you can achieve the depression of your orbicularis oris muscle. So it's gonna help you in moving the mouth downwards, if you will, to the extent that you can. So not only that, but indirectly, right? Facial expressions and so on. I talked about the deltoid. Let's see, moving down to the arm, the upper limb. We have a triceps brachii, biceps brachii, and brachialis. I've already described all of these throughout the summer session here, but real quick, the triceps is located on the posterior to the upper arm, right? It's got 3 heads, and you can feel the 3 heads as you pronate your forearms. If you pronate forcefully, right, and then touch your triceps, you should be able to feel at least 2 of the heads, depending on how strong you are. If you work out and you work on your triceps, then you feel the 3 heads. If you don't, then you should at least be able to feel 2 heads of it. Okay, so triceps is very important. It originates on the proximal end of the humerus, but posterior. Okay, so not on the side, not in the front, on the back of it, and it also has origination points on the scapula, and again on the humerus. All right, so now the insertion point of it is going to be on the condyles, if you will, of the radius and ulna. Okay, so those insertions right there are going to go ahead and allow you to bring the extend the forearm after flexion. And so if you flex your forearm, right, by using the biceps, and go ahead and flex it, to bring it back again, you're going to need the triceps. The biceps brachii, this has been discussed already, right? Originates on the upper aspect of your humerus, but on the anterior side, and then it goes on further to the clavicle and the scapula. Okay, so that's where it originates. It goes ahead and inserts on the anterior end, right, of the ulna and radius that are proximal. Okay, so on the proximal ulna and radius anteriorly. So that's where that originates. Its contraction pulls in that direction, right, towards the midline, and it pulls on the forearm for flexion. So that's the biceps brachii. The brachialis and brachioradialis are synergist to the biceps. Okay, they play a role in in flexing the forearm. Okay. Now, brachioradialis, for example, has more functions. So aside from flexing, it's also involved in all of the actions of the forearm and also of the hand. All right, which I'll get into either by the end of today or maybe on Monday and Tuesday. Now the forearm, right, has a few major superficial muscles that you should be able to feel, right? So pronator teres, for example, allows you to pronate, right, your palm. So if you're using anatomical position, just like this dude right here, right, pronation is the action of turning that palm to the back. Okay, so if you do that, you pronate. So that's the action of your pronator teres. All right, so it's going to go ahead and originate on the proximal end of the radius and ulna, and then it's going to go ahead and insert right here through some tendons, right, on the bones of the hand. So you can go ahead and pronate that hand. Brachioradialis, it's located right here on the external lateral end, right, of the forearm. So that one originates on the distal end, right, of the humerus, and then it inserts again onto the carpal wrist bones, right, slash the phalanges, if you will, so that you can go ahead and move your hand. Okay, but it's not only involved in that, it's also involved in the flexion, right, of your forearm. So flexor carpi radialis, right? It originates on the radius, and then it inserts onto the carpal bones of your wrist in order to flex that wrist. So the reason why you're able to flex it is because, and grab for that matter, right? So it allows you to grab stuff, right? Is because, again, of the action. Actually, the action of all these muscles, but mostly the flexor carpi. We have a palmaris longus and a flexor carpi ulnaris. The palmaris longus is involved in the entire movement of the palm. It's a synergist muscle, right? And then a flexor carpi ulnaris goes ahead and again inserts onto the bones of the wrist, but it originates on the ulna rather than on the radius. All right, so in that manner, these two flexors work synergistically to allow you to flex your hand, okay, your palm. Okay, now talk about the neck. Let's move on to this side and talk about the thorax. Okay, so the thorax, otherwise known as the chest, the thoracic cavity. Okay, so we have pectoralis minor, pectoralis major, serratus anterior, and intercostals. These two have already been talked about, the pectoralis major. Okay, so that one I've already discussed. Pectoralis minor is located underneath the pectoralis major. And it actually originates on the costal bones, which are the rib bones right there. And then it inserts onto the proximal end of the humerus / clavicle. All right, so they're involved in the movement again of the arm. Pectoralis major originates on the sternum, on the clavicle, and it inserts onto the proximal end of the humerus to again move the arm. Serratus anterior, right? So it's these muscles are located superior but lateral on the rib cage. Okay, so those, and then we have the intercostals muscles. So all of those are involved in expanding the rib cage so that you can actually breathe, right? So serratus anterior, intercostals, both of those work together in order to do two things. Again, lift the rib cage and expand the rib cage so that you can have more volume for those lungs to go ahead and what's it called, expand, if you will. So it's expand with air, obviously. Yeah, the serratus also has other functions, like for example, movement of the arm, rotation of the arm, and so on. But there's more direct muscles that allow you to rotate, the arm at the acromioclavicular joint right here, like the rotator cuff, for example, okay, which has 3 to 4 muscles. So intercostals, talk about that. Respiration. Yeah, so intercostals are mostly just for respiration, breathing in, breathing out. Okay, so abdomen. The abdomen would be next. These are superficial muscles again. Starting with the rectus abdominis, right? So this is a major cosmetic type of muscle, right, which has a lot of importance. Right? Don't we all wanna achieve, right? A great rectus abdominis muscle, right? So that 6-pack, 8-pack, if you will, right? So this is a rather long muscle. Okay, so it's a long muscle which is divided up into several bellies. All right, so 2, 4, 6, 8 bellies. Its origination point, you would think, right? It originates right here on the lower ribs, but it doesn't. It actually originates down here on the pelvis. Okay, so that's where it originates. It inserts onto the costal bones, right? The ribcage bones, sternum, and its action is going to go ahead and contract, right? So it's fibers contract downward so that you can actually flex your entire trunk. All right, so by pulling on those fibers, you pull downward, and you're able to do those crunches, right? If you do a lot of crunches, a lot of abdominal workouts. Again, originates on the pelvis and inserts onto the lower end of the rib cage so that you can flex your entire trunk, okay? Therefore compressing your abdomen. All right, so that would be a very direct, movement, vertical movement, if you will, of the trunk. Now the obliques, internal, external obliques, and transversus abdominis, those allow you to move your trunk and contract it, right? Flex it, but to the side. It allows you to do those side. I'm sure there's a name for those. The crunches at an angle, right? If you know the name, tell me the name. So if you want to work this out, then you're gonna have to contract your entire trunk, right? Maybe I think it's better if you like lay down on the floor, and then do your regular crunches, but then to some extent, you kind of have to rotate to the side at an angle, if you will. So that's gonna, again, work out your oblique muscles, which are located diagonally. They run diagonally on the abdomen itself, okay? So again, internal obliques, those are diagonal, and then transversus abdominis is not necessarily diagonal. It runs horizontal, right? Originating on the on the iliac crest of the pelvic bone, and then it inserts right onto the rectus abdominis through an aponeurosis, through that tendon right there. All right, so its contraction pulls in that direction, and that allows you to indirectly rotate your entire trunk at an angle. Okay, so and also rotation. I know I'm saying I'm talking about this in the form of exercise, but if you're just doing regular movements, right? Say you're walking down the street, and then right behind you, so a pair of dudes start fighting, right? And all of a sudden you rotate your trunk, right, to see who's fighting. Again, that's your transversus abdominis / oblique abdominal muscles at work right there. Let's see. ¿Qué más? So pelvic, let's talk about the pelvic superficial muscles, right? By no means an extensive review of these muscles. There's a lot more, which we're going to talk about next week, including the reproductive pelvic muscles. Okay, so, but for today, right, we have a tensor fascia lata muscle right there. Okay, like it has the name of a drink from Starbucks, right? But this tensor fascia, right, allows you to abduct your entire leg. So the reason why you would be able to move your entire leg upwards in that direction, abduction, right, to some extent, is the action of the tensor fascia muscle. So it originates on the lateral crest externally, right, and then it inserts onto the tibia, right, but on the lateral side of the tibia, if you will. So that's where it inserts. Its contraction moves its fibers upwards, which is going to go ahead and pull on the leg laterally, allowing you to do that abduction of the leg. Iliopsoas. Yeah, so here's the iliopsoas. It's going to go ahead and originate on the internal iliac crest. And then it's going to go ahead and insert onto the proximal femur. Okay, so again, it inserts onto the proximal femur to play a synergistic role in flexing of your leg, but to the front, if you will. So not to the side, you flex it forward, if you will. All right, so now that again, that only plays a role in flexing of the upper aspect of the leg, right? If you like to flex the lower aspect of the leg, then you need other muscles. You need the hamstrings. So it's only gonna allow you to flex this part, right, of the leg. Okay, so that's the iliopsoas. Here's a pectineus. It is also involved in the flexion of the upper aspect of the leg. So it would be like a synergist to the iliopsoas. These two work together. But then the pectineus is also involved in adduction. All right, so it's going to go ahead and work opposite to the tensor fascia, right, in bringing that leg back and stabilizing it as you move that leg back. Now, that stabilizing action might not look very pertinent right now, very important, but believe me, as you're running, you wouldn't believe how important those stabilizing muscles are, right, in bringing that leg back to a position so you can keep going with your gait, right? So very important in keeping up with that, rhythmic gait, if you will, right? So again, pectineus, different actions, adduction and flexion. Now, for complete adduction and complete stabilization of your leg, yes, you do need the pectineus, but you also need the adductor group right here. Okay, so this is the adductor group, excluding the sartorius. Okay, so without the sartorius, you have the adductor longus right there. You have gracilis, and those two, along with the pectineus, are going to work together in adducting that leg. All right, so again, notice the difference between abduction, ABD, and adducting, ADD. Different actions. I talked about sartorius. So the sartorius inserts on the iliac crest laterally, and then it goes ahead and inserts onto the tibia, right, on the side, if you on the opposite side of the tibia. So notice how it traverses the entire leg at an angle, right? So that right there allows you to rotate your leg. So sartorius is for rotation of the leg. Now the rectus femoris, vastus lateralis, vastus medialis, those three are involved in the quads. So those would mostly make up the anterior aspect of your upper leg. All right, so those nice muscles that that come out, right, as if you run a lot, right? Again, those are collectively known as the quads, but they're mostly made up of rectus femoris, vastus lateralis, and vastus medialis, right? What do they do? Well, they insert onto the proximal end of the femur. All right, so they're going to go ahead and insert up here on the femur. And then, for example, the vastus medialis also inserts on the pelvic bone, on the ischium, right, and pubis of the pelvic bone, to allow you to go ahead and bring your flexed lower aspect of the leg back to anatomical position. All right, so assuming that you use your hamstrings to go ahead and flex, right, this aspect of the leg, you flexed it with the hamstrings, which are located on the back. The quads are going to go ahead and work opposite, antagonistically to the hamstrings, to go ahead and bring that leg back to anatomical position. Okay, so again, insertion upper end of the femur, origination, I'm sorry, and then insertion on both the patella and also the tibia and the fibula bone of the lower leg, to allow for that extension, right? So we call it extension of the leg. Okay, so moving down, right, we have the lower aspect of the leg, which includes the fibularis longus, right, which is this big muscle located laterally on the outside, right? If you play soccer or if you run a lot, you have a rather large fibularis longus, okay, which looks like a like a curve that extends outward on your lower leg. Okay, so it goes without saying the importance of the fibularis longus, right? It allows for plantar extension, right? So it's involved in plantar extension, and evidently, right, all of these muscles work together in achieving gait, in achieving walking, running. Okay. Now, specifically, again, fibularis longus and tibialis anterior allow you to actually they work antagonistically. So this one extends the feet, and this one flexes the feet. Extensor digitorum longus, these are involved in the movement of your toes. Okay, so they extend your toes. Gastrocnemius is a calf muscle. This is mostly located posterior. I'll show it to you in the other slide. Okay, so this would be your calf muscle right here. It's got two heads, which can be pretty bulky. Okay, so if you work a lot by flexing your plantar region, then flexing and extending it, especially with weights. If you're carrying maybe kettle weights on your hands, and maybe you have a backpack that has weight, maybe a weighted vest, right? And you all of a sudden start doing these exercises of walking on your toes, and also flexing and extending your plantar region, your feet. Then you can work out your gastrocnemius, right, and make it very, very bulky. Okay, so let's look at the superficial muscles, but now in a posterior view, so of the back, if you will. Starting with the neck, right? So I talked about the epicranius already. This is the occipital belly. I talked about the sternocleidomastoid already, right? Allowing you to rotate your head to the sides. Here's the trapezius, right? The trapezius muscle is a rather large muscle, right, which you can actually feel on the back of your neck, right? So if you go ahead and feel the back of your neck, that is the beginning, the start of the trapezius muscle. Okay, so now it's got many origin points. So it's got origin points on the occipital bone, it's got origin points on the cervical vertebrae, on the thoracic vertebrae, right? And also on the clavicle / scapula, right? So it's that big, and then it extends down onto the lumbar, the beginning of the lumbar region, okay? So its contraction, right, is gonna be differential. So you can contract this muscle differentially, right? You don't have to contract the whole thing at one given time. So for example, if you contract the muscle here at the cervical region, then what that's going to do is it's going to go ahead and allow you to pull your head backwards, right? So if you look up straight into the sky, right? As long as there's no sun, right? Don't do that, right? But if you look up, that would be mostly the action of the trapezius at the cervical level. Okay, so now go ahead and shrug your shoulders, right? So just as if you were going to say, I don't know, right? You can do that on your on your left side independently of the right side, or you can do both at the same time, right? If you do that, you can actually feel. So if you contract, you can feel the shoulder aspect of your trapezius muscle, right? So, and by the way, the trapezius, right, is that muscle where you get your massages on, right? So if you get a shoulder massage, well, that person's massaging your trapezius muscle on the shoulder end and also on the neck end. I highly suggest you get one of those. Really, really good. Now, this region right here is where a lot of stress concentrates on, okay? Because as you're studying, especially academic stress, as you're studying, right, you're tilting your head forward for reading, right? Maybe looking at your computer, doing research, right? So again, that concentrates a lot of that stress right onto this region right there. Okay. So if you find, I know there's devices out there that can massage this region, right? Or if you can afford a massage, they're gonna go ahead and move down into this region here, which alleviates a lot of those muscle knots, quote unquote muscle knots. Okay. Muscle knots are essentially microscopic tears on the muscle, and they occur very often on the trapezius muscle, right? On the thoracic region aspect, right? Of the trapezius. So as I was saying earlier, you can differentially contracting the shoulder end of the trapezius allows you to do the shrugging, right, of your shoulder. So saying like as if you were saying, I don't know, right? But if you contract the thoracic end, right, of the trapezius, then that has different functions. Notice how the trapezius is indirectly connected to the deltoid, right? But also to the latissimus dorsi and the rotator cuff muscles like teres major and teres minor in the scapula region, right? So its contraction on the thoracic end is going to help in moving of the arm, but towards the back. So like kind of retracting the arm, right, towards the back. So if you're building up muscle and you're working on building up your body, right, this is one of the areas you have to work on, because making your back larger, right, includes developing the trapezius muscle on the thoracic region, right, which indirectly is going to go ahead and work together, if you will, with rotator cuff and latissimus dorsi to allow for the movement of this entire joint, but towards the back, so retracting instead of protracting the joint. Okay, so in order to, since I already brought this up, in order to protract your shoulder joint, okay, so you're gonna have to go ahead and rotate your entire arm forward, right? So bring your left arm and touch your right shoulder. That action is a protraction, right? So bringing the arm forward and lifting it forward, for that matter. That's protraction right there. So the opposite would be retraction, right? So moving the arm back into position, but then further out, right? Again, that takes the trapezius, it takes rotator cuff, teres major, teres minor, which are right here, I'm sorry, and then latissimus dorsi. I talked about the triceps brachii, I talked about the brachialis, brachioradialis, extensor carpi radialis. I talked about all these right here. Now on the forearm, and I'll get into the details of these. On the forearm, right, if they're called flexors, then they're gonna go ahead and allow you to flex your forearm. So bring that forearm up. Okay, so exclusively just the forearm, not the arm, just the forearm. If they're called extensors, then what do you think they're gonna do? They're gonna do the opposite action, right? So they're gonna go ahead and allow you to extend the forearm so you can bring it back to anatomical position. On the shoulder, I touched on most of these. We have the deltoid, which I talked about already. We have the infraspinatus, which is part of the rotator cuff. We have the teres major, which is part of the rotator cuff as well. We have the teres minor, which is also part of the rotator cuff. And then the rhomboid major here, which works together with the trapezius and latissimus dorsi in retraction, so movement and rotation of the arm, but again towards the back. Okay, so the rotator cuff muscles are going to work antagonistically with the arm and pectoral muscles in again retracting that arm and moving it back to anatomical position. The latissimus dorsi is the largest muscle of your trunk. So your entire upper body, right? Latissimus dorsi is the biggest muscle of your upper body there. Notice how it extends from the ventral region. Yeah, so here's the ventral region. Here's one. Here's the other ventral region, obviously on both sides, given that we're bilateral organisms. So that's where it originates, right? It originates on the vertebrae, more specifically on the transverse processes of the vertebrae. Now, which vertebrae, right? So thoracic vertebrae and lumbar vertebrae. So that's the origination point. The latissimus dorsi also originates on the iliac crest, but on its posterior aspect. Okay, so this would be the iliac crest right here. Here's the other iliac crest, and then look at all the connections, right? There's connections from this muscle all the way over to the lumbar vertebrae, and also down to the sacral vertebrae. And again, this is I don't think no I did talk about the aponeurosis. I talked about this aponeurosis, right, which connects the occipital belly with the frontal belly of the epicranius. An aponeurosis is basically a tendon, right, that connects two muscles. Here's another aponeurosis. Okay, so it's located on your lumbar region, extending down to the sacral region. That aponeurosis connects the latissimus dorsi and the gluteal muscles, right? In order to be able to connect them to their respective bones, right there. So aponeuroses are tendons, basically. Okay. So here's the origination point, right, of the latissimus dorsi. I've talked about that. The insertion point is going to be on the humerus, right? So it connects on the medial but superior proximal end of the humerus to again play a role in the movement of your arm. Okay, your arm can do all types of movements. Okay, it can do circumduction, right? So it can do like a circular action with your entire arm. It can do protraction, which I talked about, retraction, which I talked about, flexion, and extension. Okay, it can do all of those movements. Now, your hip joint can do all of those movements as well, but to a limited extent, because you have a lot more control over the acromioclavicular joint than the hip joint. And all I'm saying again, it's you have more precise control of these. These muscles, yeah, you're gonna have some control to a certain extent, but not to the precision that you actually control your shoulder joint there. Let's see. So moving down to the hip, and I'm almost done here. We have gluteus medius, gluteus maximus, right? So these play a role in bringing the leg, the upper aspect of the leg, back to anatomical position. They originate onto the sacral region and coccygeal region of the vertebrae. So their contraction goes ahead and pulls in that direction, right, towards the midline. And then look at this, their insertion. They insert onto the tibial lateral end of the tibia here, right, to again allow you to bring your leg back to anatomical position from a few different movements. Okay, the first movement would be flexion of your upper leg. So if you flex it, you bring it up close to your abdomen, right? That's flexion. So bringing it back, you have the hamstrings, and you also have the gluteal muscles to go ahead and bring it back. Also, abduction of the entire leg. So if you abduct, you've seen the tensor fascia muscle over here. You abduct, you go ahead and adduct using not only the adductor group, but also the gluteus and medius. Gluteus maximus and gluteus medius. All right, so that highlights the importance of the gluteal muscle. Okay, so it's involved in essentially movement of the entire leg, right? So walking, running, and so on, and more precise movements of the leg. Moving down to the hamstrings. Now I talked about the adductor group right there, right? So here's the adductor magnus. Here's the hamstring. The hamstring's made up of 3 muscles. We have the biceps femoris, which is the biggest muscle of the hamstrings, and then semitendinosus and semimembranosus. Those 3 muscles right there make up the hamstrings. All right, what do? Well, first is they originate on the posterior but superior end of the femurs. Femur, but I'm sorry, the femur. Okay, so that's where it originates, and then it inserts onto the tibia and fibula, right, of the lower aspect of the leg. Okay, so now their contraction pulls towards the midline, therefore pulling on the lower leg, so you can go ahead and flex the lower leg. Okay. So again, that's the hamstrings. In that group right there would be antagonistic to the quadriceps, which are located anteriorly, not posteriorly. Last but not least is we have the lower end of the leg. We have the gastrocnemius, soleus, fibularis longus, and calcaneal tendon right there. Gastrocnemius is your calf. Notice the 2 heads right there. Again, some of us have a wider gastrocnemius than others, right? Depending on how much you work this. There's people that walk essentially on their toes. I don't know if you've noticed, right? Some people, as they're walking, they use their plantar region to walk, but then the last stage of let me see if I can describe this. The last stage of the gait, right, involves them moving their entire body weight onto their toes. I don't know if that makes any sense, but doing that works out your gastrocnemius muscle directly, and you're able to build lower your gastrocnemius muscle in that. So there's different ways, there's different gaits, right, for different people. A lot of us walk on just the plantar region of the toe. Now, if you're aware and you want to work these gastrocnemius muscles all the time, then you'll walk on the plantar region and then shift all of your weight onto the toes, right, at the end of the gait. Hopefully that makes some sense. Again, if you do that, then you can work out the gastrocnemius essentially all the time, right? So let's see. So what the gastrocnemius is going to do, right? It's going to go ahead and originate on the proximal end of the tibia and fibula, right by the knee, if you will, right behind posterior end of the knee, and then it's going to go ahead and insert on the calcaneus bone, right, through the use of the calcaneal tendon or Achilles tendon, which is right there. Notice how large it is. Right, so its contraction pulls in that direction towards the midline, right? Pulls in that direction. So therefore, pulling on the calcaneus and allowing you to lift essentially the foot. So if I'm a little bit more precise, so if you lift that, you go ahead and shift your body weight onto your toes, right? Which is one adaptation that we have developed over the millions of years that we have evolved. That shifting of that weight allows you to transfer, right, the weight from the calcaneus bone onto your metatarsal bones, and then lastly onto the toes, right? So that process right there, right, is what we know of as the gait, right? We're able to transfer all of our body weight from this region to the middle region to the end region right there to minimize impact on the feet. Okay, so that's why People who have a flat foot, if you will, right? You've heard of that before. Their arches are not well developed. Their plantar arches are not well developed. So therefore, they're gonna over time they're gonna go to tend to place a lot of stress because of their weight onto their calcaneus bone and onto the metatarsal bones, which does not allow them to transfer effectively their weight from this bone to the middle bone to the toes, right? Again, just placing a lot more stress on their feet. So they're going to tend to suffer a little bit more than the rest, especially when it comes time to endurance training, right? Like running long distances or walking long distances and whatnot. But again, those are things you can work on and develop, right, over time.